This video will be covering Parkinson's disease and the role of the caregiver. I'll be discussing the following topics: the definition of Parkinson's disease, the stages of Parkinson's disease, the symptoms, the predictors of caregiver burden, caregiver support, the role of occupational therapy, and helpful resources. According to Maki and his colleagues, Parkinson's disease is characterized by progressive motor deterioration and the development of non-motor symptoms such as psychiatric, cognitive, and behavioral disturbances. I will be discussing these symptoms further in the video. In stage 1 of Parkinson's disease, patients experience mild symptoms that do not interfere with daily activities, such as stooped posture, facial expressions, and difficulty with ambulation. Tremors and movement difficulties are limited to one side of the body. During this stage, the caregiver or loved one can provide emotional support and assist with coping with the new diagnosis, and they can begin planning ahead for where care will take place, who will assist with caregiving, and identifying social supports. In stage 2, symptoms become more noticeable and are present on both sides of the body. These symptoms can include walking difficulty and/or poor posture, muscle stiffness, prolonged task completion, speech difficulties, and tremor or rigidity. Most people are still able to live alone, as the progression into this stage can take months or years. During this stage, the caregiver or loved one can introduce assistive technology to increase and promote independence and research home modifications to implement to make the home safer. In stage 3, symptoms include decreased reflexes, slowed movements, and loss of balance. Falls can become more common as patients become more unsteady. People with Parkinson's disease are still able to lead an independent life, but may require some assistance with ADLs. At this stage, the caregiver or loved one can implement home modification strategies or introduce fall prevention strategies. They can incorporate assistive technology or devices, begin providing increased assistance or looking into a service to help, and ask for a referral for occupational or physical therapy. In stage 4, the patient may require adaptive devices such as walkers or canes to ambulate and get around. They may require assistance with activities of daily living such as going to the bathroom, dressing, and bathing. For safety, the patient should not live alone. At this stage, the caregiver or loved one can begin to look into long-term care or respite care and ensure 24/7 supervision for safety and well-being through respite care, family, and friends. Stage 5 is the most advanced stage, with patients requiring wheelchairs and around-the-clock care. Some patients can experience confusion, delusions, hallucinations, or dementia. The caregiver or loved one should ensure 24/7 care and assistance to ensure safety and well-being and provide a comforting presence. According to Armstrong and Akun, as well as Mayo Clinic staff, the motor symptoms of Parkinson's disease include slowed and smaller movements while completing tasks, rigid muscles or involuntary muscle stiffness, resting tremor, which is rhythmic shaking, often in the hands and fingers. Another symptom is pill rolling tremor, which is rubbing of the thumb and forefinger back and forth. They may experience postural instability, such as stooped posture or inability to change or maintain posture, impaired balance, and loss of automatic movements, which are movements one makes without conscious thought. According to Armstrong and Akun, as well as Mayo Clinic staff, the non-motor symptoms of Parkinson's disease include decreased or absent sense of smell, sleep dysfunction, for example, daytime sleepiness and sleep maintenance insomnia, and autonomic dysfunction. This can include blood pressure changes such as a drop in blood pressure when standing, constipation, urinary urgency and frequency, and sexual dysfunction. Some additional non-motor symptoms include psychiatric disturbances such as anxiety, depression, psychosis, or apathy, which is a lack of interest or enthusiasm, cognitive impairment such as dementia, thinking difficulties, and executive functions, and other symptoms such as fatigue, pain, speech changes, difficulty writing, and difficulty swallowing. According to Greenwell and her colleagues, caregiver burden predictors with Parkinson's disease include a care recipient with a diagnosis of depression, longer disease duration, greater cognitive impairment and neuropsychiatric symptoms such as delusions and agitation, care recipient with increased difficulty with ADLs, mobility impairment, and intensity of caregiving. According to Zong and his colleagues, caregiver burden predictors with Parkinson's disease include caregiver or care recipient depression and anxiety, the feeling of losing the personality of a loved one, a care recipient with cognitive impairment, apathy, and psychosis, accumulation of negative emotions and memories throughout the course of the condition, and disease duration and progression. Throughout the stages and progression of Parkinson's disease, it is important to remember to seek out support and resources for yourself. Some ways to support yourself as a caregiver include identifying social support systems, including family, support groups, and friends. Utilize and introduce assistive devices and home modifications to promote care recipient independence. Schedule out and engage in daily, weekly, or monthly social support and activities. Inquire about occupational or physical therapy referrals from your care recipient's doctor. Ask for assistance from friends, family, or respite care to provide you with a break. Begin looking into long-term care and increased supervision. And engage in stress reduction techniques and identify coping strategies. According to Ratter and her colleagues, occupational therapy enables performance and participation in meaningful activities and roles. The role and goal of occupational therapy in patients with Parkinson's disease is to introduce compensatory strategies for activities of daily living, such as cognitive strategies like planning, problem solving, and time management, as well as assistive devices and environmental modifications. They would provide assistance in setting realistic goals. They can adapt tasks, routines, and the physical environment. They would provide patient and caregiver education and training, and provide education on activities to increase fine motor coordination. Patients with Parkinson's disease would require a referral for occupational therapy or physical therapy from their doctor. Some Parkinson's disease resources include Parkinson's Foundation Helpline, American Parkinson's Disease Association, and Parkinson's Resources. In addition to the resources I mentioned in our helpful resources presentation, these are some specific resources for caregivers of a loved one with Parkinson's disease. These include online resources like support groups and blogs. There are many virtual support groups as well as in-person local groups depending on your area. There are some supportive websites for caregivers like the Michael J. Fox website and the Parkinson's Foundation Care Partner Program, which is an interactive self-paced course. One book I found to be helpful was called Caring and Coping, A Care Partner's Guide to Parkinson's Disease. These are my references. Thank you so much for watching.